There's a new report out about the death of a Kent County infant and the system that's supposed to help keep kids safe. A state watchdog found the state could have done more to protect 2-month-old Wesley Rao. Target 8 investigator Susan Samples tracks the findings of the child welfare watchdog and joining us now with what she's learning. Susan, first, how did Wesley Rao die?
Right, to remind people, in August 2023, the medical examiner said Wesley Rao, he was 2 months old, died from asphyxia by suffocation due to co-sleeping with his parents. The sheriff's department said that he appeared to have been dead for some time when he responded to their home on 19 Mile. They called the conditions in the home deplorable, said there was alcohol, drugs, drug paraphernalia. They said Jennifer Mast, the 41-year-old mother of Wesley Rao, had admitted to drinking vodka and smoking pot before taking the 2-month-old to bed with her and awakening to find him dead. The watchdog noted that Mast had lost parental rights to previous children due to substance use and domestic violence. And the Office of Child Advocate, this watchdog, says that CPS received a tip about poor conditions in the home less than a year before Wesley's death, but failed to appropriately assess the level of risk to Wesley. They were actually at his home after his birth, so they did check in. There was a home visit, but this watchdog says they didn't do enough to assess the risk to Wesley Rao. So that's what they're laying out in this report. And they're saying, we're not doing this. This is the Office of the Child Advocate to place blame. We are doing this to try to improve the system overall. So the Michigan Department of Health and Human Services, which oversees Children's Protective Services, looks at this report, agrees with some of it, says we're going to look at implementing or strengthening guidance for CPS caseworkers so we do a better job protecting our children. This is a complicated system.
Yeah. And Susan, you've covered the watchdog agency for a long time. What can you tell us about it?
Well, it used to be the Office of Children's Ombudsman. Now it's the Office of the Child Advocate. And like I said, they're very careful. They don't want to be seen as criticizing CPS or placing blame on CPS or CPS caseworkers who have an incredibly difficult job. And so the Office of the Child Advocate wants only to improve the system overall, which is made up of all of us. It's everyone's responsibility. It's the parents, it's the state, CPS, it's the, the schools, courts, police. It's all of our responsibility, and how can we make that system work better? So that's what we're looking at tonight at 5 and 6.
All right, Susan Samples reporting for us. Thank you, Susan.